am Susanne Halken. I'm a pediatric allergologist, and I have had the pleasure to be the chair of the task force of the Allergen Immunotherapy Prevention Group, together with a lot of engaged people, including Désirée, Larenas-Linnemann, and
yeah, thank you, Susanne. As we all know, allergy oftentimes starts in childhood, and many times it starts with allergic rhinitis, and quite some of those patients with allergic rhinitis, children, but also adults, on the long run go on developing asthma. So I think it was very important that as part of the Allergen Immunotherapy Guidelines project, we also had this specific task force on prevention. Because it has been shown, as Professor Graham Roberts already told you with allergic rhinitis, that allergen immunotherapy helps to reduce symptoms and medication use, and it even has a long-term effect. But now, what about prevention?
luckily we found good evidence and can now recommend allergen immunotherapy for children and adolescents with allergic rhinitis and allergy to pollen, birch and or grass pollen for a 3-year course, not only to prevent symptoms and reduce the need for medication, but also to prevent the development of asthma in those children. This effect appears to last at least up to 2 years after treatment have stopped, but there are indications also that it may continue even longer. We could not find sufficient evidence to recommend the same for other allergies, like allergy to house dust mite, but I'm sure that studies will give us data later on so we can do recommendations for that as well.
Yeah, exactly. So there's not enough data yet for the other allergens, and we really hope that with the update of the guidelines in some 2-3 years, maybe there's more evidence also for other allergens. Then a little bit more on the details of the study. Well, we saw the effect was even stronger in the patients under 18, and it was just for sublingual, but also for sub-Q immunotherapy.
And also we don't know yet whether this effect also will be for those with milder allergic rhinitis, but there are some indications that it will be. So maybe in the future we can also recommend for children and adolescents with milder disease to prevent their symptoms, their medication use, and prevent the development of asthma.
Yeah, so as a whole, we are really very happy with these results, although we also have seen that there's still many gaps, and we hope to fill them in the future.
Yep.